Hello, this is Stridor semiology by the SchrDbb with reference a practical guide to issue taking and clinical examination by Anwar Qais Saadoon. So we are going to visualize Stridor. So what's the definition of Stridor? The Stridor is a high pitch, harsh or loud, inspiratory crowing sound generally caused by an acute or chronic obstruction of the airway between the nose and the large bronchi. So that's the upper respiratory tract. Upper respiratory tract is involving every airway till the bronchi, and lower respiratory tract is from the bronchi down till the bronchus and the alveoli. So let's take an example of a stridor. If I make this sound, it's a stridor. So that is a stridor. So a stridor is a high pitch, harsh inspiratory crowing sound caused by obstruction in the upper respiratory tract. So that is. Are you getting? So that is, it can be divided into acute and chronic stridor. Acute stridor is mostly caused by infection, so most commonly croup or upper airway obstruction, and chronic stridor is congenital abnormality. So now we have short case scenario. So short case, I have a 3-year-old child that presents with a crowing noise on inspiration, that is already a stridor. Barking cough is steroiditis in upper respiratory tract. Hoarse voice is telling that they have involvement of the recurrent laryngeal nerve or the supply of the muscles of the recurrent laryngeal nerve, that's swelling of the arytenoid muscles or the vocal cord. So the condition was preceded by rhinorrhea and cough. So rhinorrhea and cough steroid, you had infection in the upper respiratory tract with sore throat and low grade fever. So this is upper respiratory tract infection. The common symptom get worse at night. So what's the diagnosis? The diagnosis is a cough. When you see barking cough, you see mostly barking cough is peculiar for cough. That's a laryngotracheal bronchitis. This typically affect children who are between 6 months and 6 years. Are you getting? 6 months and 6 years mostly common for cough, and you are going to have a barking cough that I've already described initially, which is that's a barking cough. It is usually preceded by a common cold lasting 1 to 3 days. So that is very, so cold is usually preceded by a common cold. And if it is preceded by a common cold, you can think of a viral cold. If it's preceded by cold, because common cold is due to rhinovirus, so it implies that the cause of the cold is going to be viral, that is due to the rhinovirus, and you are not going to require any treatment for that except from conservative. It's usually resolved gradually over 1 week. Are you getting? The next thing is a 2-year-old child present with recurrent attack of sudden onset stridor. You have a barking cough, you have hoarse voice, you have respiratory distress. The symptom usually was at night, and there is no cold symptoms before that. So it's still a cough, but this one is a spasmodic cough. So this is usually because you have this term again, barking cough. This usually occurs between 1 to 3 years, spasmodic cough. So it occurs mostly at night. Cold symptom often absent. You don't have that rhinorrhea, you don't have cough, you don't have fever. Attack are severe and recurrent, but usually lasts for a short period. So it's due to the spasms of the larynx that you have this spasmodic cough. It's not due to an infection. So you have a 3-year-old female child presenting with an acute onset stridor, sore throat, drooling, high-grade fever, still high-grade fever, muffled voice, difficulty in swallowing. So if it's now affecting, so you still have that stridor, it means that it's upper respiratory tract, but here you don't have a barking cough again to tell you there is no cough. So you have upper respiratory tract infection. That you have stridor, you show that there's upper respiratory tract obstruction, and then there are high-grade fever to show you that there's an infection somewhere. And now if there is difficulty in swallowing, so you have dyspnea, you have difficulty in swallowing and SchrDbb, that you know that it's going to be much more of an epiglottitis, and inability to speak or lie flat. So this is an epiglottitis. This is usually common in 2 to 7 years or who did not receive the Haemophilus influenzae vaccine, because epiglottitis is much more common with an Haemophilus influenzae type B bacteria. So they did not refuse to receive this vaccine. The cough is usually absent or slight. The child with epiglottitis is usually toxic and unwell, because the epiglottis is the one that controls both the airway and also for the digestive tract, so for when you are swallowing. So if you are that, the child can easily choke. A 4-year-old, so that's why this is a child is usually toxic and unwell, and you must give your children according to expanded program of immunization in Cameroon with Haemophilus influenzae type B. So we have the next one now, which is given under the Penta vaccine. So we have the next one, which a 4-year-old male child present with a brassy cough, stridor, respiratory distress. If you have a barking cough, it's much more involved the larynx. If you have a brassy cough, it much more involved the trachea. It is a bit down, and a brassy cough is as such. That's a brassy cough. A brassy cough. So stridors, that is much more going to be in the lower. It's still a cough, but it's much more in the trachea, more less in the larynx than in the trachea. So it's a pseudomembranous cough. It's a bacterial tracheitis. So you have respiratory, you have high fever, telling you that it's an infection. So they preceded by viral infection. He does not drool, and he is able to lie flat. If he drools and he cannot lie flat, you think of epiglottitis. But if he does not drool, and drooling means that what spit comes from his mouth, he does not want to swallow it because he has difficulty in swallowing. That is drooling. But if he does not drool, it means that the epiglottis is not involved. It's only the trachea is involved, so he can swallow without any problem, and is able to lie flat also. So it is the usual age between 3 and 10 years with a slight male predominance. It's between 3 and 10 years with a slight male predominance. It is often preceded by a viral respiratory infection. A 1-year-old previously well male child presents with sudden onset stridor. If you have stridor, respiratory distress, severe cough after a issue of cough of stroking, you have a foreign body aspiration. So focal wheezing may be present. There is a issue of sudden choking. There is no response to medication. A 2-month-old child presents with intermittent stridor that worsen or may only be present on crying, exertion, lying flat. It is improved by neck extension. So if you have a 2-month-old child who still have stridor that worsen or may only be present on crying, exertion, or lying flat, it's improved with neck extension. Think of laryngomalacia. Laryngomalacia improves when you are lying flat and you have neck extension. So this is characterized by intermittent stridor that worsen or may only be present on crying. So stridor worsen or only be present on crying, exertion, or lying flat. Are you getting? It often develops a habit in the first 6 weeks of life. It often improves and resolved by the age of 2 years. That's laryngomalacia. A small constriction inside the larynx. Are you getting? So you have a 2-year-old male that presents with stridor, respiratory distress, fever, irritability, drooling still coming from the spit. He has difficulty in swallowing, that shows drooling. Muffled voice, difficulty in swallowing, neck pain, and decreased oral intake. You can think of a rectopharyngeal abscess. This occurs in children less than 4 years. About 2/3 of the patients have a recent issue of a throat ear or nose infection. So let's come back to the issue taken in Stridor. We have to take identification, chief complaint, the issue of present complaint, still with the onset, sourcing of character, the duration, acute or chronic, the timing, daytime and night time. You have is there any antecedent recurrent respiratory infection? Is there an issue of choking? That's the associated symptoms. Infection, choking, what are the aggravating factors? Increased stridor with agitation, supine, crying. Is it relieved by rest, spatial position, neck extension? If it's relieved by neck extension, you think of a congenital laryngomalacia which occur at 6 weeks of life. Is associated with symptoms, respiratory distress, fever. How high is the temperature? Are you getting? Sore throat, voice change and all that. Past history, birth history, you have perinatal trauma, you have method of delivery, you have forced delivery, you have shoulder dystocia, or everything that can result to prolonged labor is going to make a child having acute fetal distress and then it's stridor. The next one, you have past medical or surgical history. You have and this stridor can be considered just like a grunting in a child. What we see in children unit is not going to be stridor, but instead a grunting, and all this can predispose to grunting. So past medical issue, you have issue of choking with the foreign body aspiration, issue of similar episodes in the past. If you have similar episodes in the past, you can think of any of a spasm, like in a spasmodic group. If you have age of onset of the first attack, so if it is less than 6 weeks, you can think of, if it's at 6 weeks, you can think of a laryngomalacia. If it's at 1 to 6 years, you can think of a those different disorders which you have seen above there. So immunization issue for Haemophilus influenzae type B is much more common because we want to rule out the fact that the patient can have epiglottitis, but there is also for pertussis. If they have pertussis, they turn up because pertussis can result to a croup. Are you getting? And you have also bacterial tracheitis. Bacterial tracheitis can result to other bacteria which are inside the expanded program of immunization. So we have family issue, the same symptoms in the family. Is there somebody having same symptoms in the family? Is there overcrowded house, social overcrowded house, and review system you try to visualize. So what are the key points that you can have in case of a patient that has stridor? A sudden onset of stridor with the issue of choking, you think of foreign body aspiration, and that's particularly in a toddler or a child between 6 months to 3 years. So stridor with the issue of an allergy. If you are stridor, thinking of allergy. A stridor in the issue of allergy, that is anaphylaxis due to an angioedema, that is the swelling of the subcutaneous tissue of the peri-airway region. So if you have persistent fixed stridor, may be caused by a vascular ring. A persistent fixed stridor may be caused by a vascular ring, or it may be infrequently be a result of vocal cord paralysis or severe micrognathia. So Pierre-Robin sequence. So if you have a persistent fixed stridor, a stridor that is persistent, so it is not recurring over a period of time, you think of a vascular ring. That's when you think of a vocal cord paralysis, and you think of severe micrognathia. So you see, and severe micrognathia with persistent stridor occurring in a Pierre-Robin sequence. Okay. The next one, and what is micrognathia? Micrognathia just means immature development of the mandible. So this patient usually have a very small chin, micrognathia. So now the next one now is stridor at the rest at the rest indicate condition that needs hospital admission. So we are finished with stridor. The next thing you're going to move with is chest pain. Thanks for your kind attention.